Hello, everyone. We're Group 12, and today we'll be talking about traumatic brain injury, better known by its more common acronym TBI. In this presentation, we'll discuss TBI's most common occurrences, such as in high impact sports like football, as well as combat veterans in the military. Additionally, we'll be going over some of the current medical treatments and research being done about traumatic brain injuries. First of all, I'll be going over a bit of background knowledge that'll be brought up in the rest of the presentation and will be useful for understanding the content of the articles. Traumatic brain injury is defined as brain damage which can be caused by a variety of reasons, whether it be an object penetrating the skull, a blunt force trauma, or even the force from an explosion. Either way, an external force impacts the head, breaking blood vessels, rupturing neurons and their cell membranes, and potentially leading to blood clots. Due to the increased blood flow, there will be a buildup of intracranial pressure as well as significant swelling of the brain. Burst brain cells leak various chemicals, with a neurotransmitter molecule known as glutamate being one of them. Unnaturally high amounts of glutamate are indicative of rapid cellular damage in the brain and is associated with TBI by health professionals. Next, chronic traumatic encephalopathy, or CTE, is a progressive neurodegenerative disease caused by repetitive cases of traumatic brain injury, with a scan to the right showing different degrees of severity in CTE cases. These repeated head injuries lead to changes in mood and behavior, as well as declining cognitive capabilities, with symptoms including disorientation, headaches, impulsive behavior, and in severe cases, memory loss and dementia. Now, an important pathological characteristic of CTE is the presence of the protein known as tau. A CTE patient will have significant tau deposition around small blood vessels throughout their brain. Tau aggregates in clumps around nerve cells and is associated with various neurological disorders such as Alzheimer's and Parkinson's disease. Now I'll also be going over a few neuroanatomical structures that are relevant to the rest of the presentation. First of all, the blood-brain barrier is a semi-permeable membrane that prevents contaminants in circulating blood from reaching the brain's neurons. In cases of CTE, it is possible for the blood-brain barrier to be damaged or disrupted from the repeated trauma. This allows for contaminant molecules to leak across the barrier and into the brain itself. Next, although traumatic brain injury can affect any region of the brain and isn't limited to one particular area, one region that is commonly known to be impacted is the hippocampus. Hippocampus is located in the medial temporal lobe, which is the area highlighted in green in the diagram, and is part of the limbic system. As mentioned in previous lectures, the hippocampus regulates memory formation and spatial memory, among other functions. In CTE patients, the hippocampus is known to be in deteriorated condition with loss of neurons and potentially even memory. Next, the clear and watery substance which fills the space around the brain and spinal cord is known as cerebrospinal fluid. This fluid fulfills a number of functions, including circulating nutrients from the blood and removal of waste products. In this case, however, the relevant function we're interested in is its capacity to act as a shock absorber for the central nervous system by cushioning impacts. In addition, samples of cerebrospinal fluid can be taken to assess the presence of biomarkers for certain diseases or infections. Lastly, a myelin sheath is a mix of proteins and phospholipids which coats the axons of neurons and allows for saltatory conduction for faster propagation of signals in the brain. When exposed to brain injuries, myelin sheaths come under stress and become damaged, leading to decreases in cognitive abilities over time. This first article provides an in-depth discussion of the growing significance of TBI and the increased public and research interest in its consequences like CTE. Based on the CDC's findings, 1.7 million people sustain a traumatic brain injury each year in the United States alone, with 52,000 deaths. Recently, there has been increased awareness of TBI due to athletes in football and boxing, as well as military personnel. Nowadays, researchers classify TBI cases on a spectrum instead of as a single discrete entity. Depending on the severity of the trauma, TBI can range from a mild concussion all the way up to a neurodegenerative disorder like CTE. CTE itself has been recognized as sharing pathological similarities with Alzheimer's disease, another chronic disorder associated with memory loss and dementia. Because of this spectrum of TBI, clinical diagnoses and treatments have to be carefully carried out depending on the severity of the brain damage. There is also an ongoing research effort into discovering TBI biomarkers. This is an incredibly important point because currently there is a distinct lack of biomarkers in CTE patients, which presently makes it impossible for doctors to diagnose patients while they are alive. As a matter of fact, CTE diagnoses can only be performed in post-mortem examinations, highlighting how important it is to better understand the physiology of CTE in living people. Because of the significance of TBI research, there has been a push for networked archives of tissue banks dedicated entirely to TBI, as well as improved epidemiological monitoring to benefit international research. Currently, research into TBI is also aimed at investigating the risk factors for CTE, such as whether patients can have genetic susceptibilities for it, as well as methods for finding TBI biomarkers in blood and cerebrospinal fluid. In the past, TBI has tended to be termed a silent epidemic. However, with continued research efforts into its effects and increased public interest, TBI has since escaped that label. By better understanding its causes and consequences, researchers hope to be able to prevent and treat future cases.
Within the last few years, a lot of attention has been drawn to the prevalence of head injuries received as a result of playing contact sports, such as football. This is addressed by a player named Brandon McManus in the article Chronic Traumatic Encephalopathy, A Player's Perspective. In football, it is extremely common for a player to get multiple concussions during their time playing the sport, which can lead to the development of CTE. There is fear around younger children playing because the axons of their neurons are not fully coated in myelin, which protects the axons during collisions. This means damage from playing football could have a larger impact on the brains of younger players than it does for older players with more developed brains. Also, younger children have weaker neck and torso muscles, which means their heads can be jostled more when they are tackled. McManus points out how important it is to teach young players how to play safely. He goes on to explain that in order to prevent concussions, coaches must take the time to teach proper technique, such as keeping their heads up instead of letting them sink down, which puts them more at risk for an injury, and that players should have well-fitting equipment rather than hand-me-downs that don't provide the needed protection. He explains that as he progressed through his football career from children's teams to high school to college, the higher level teams were able to hire specific trainers to help build up their neck and torso muscles and to teach proper technique. And they were fitted at the beginning of every season with new equipment, which made it safer for them to play. These resources tend to be unavailable to younger players due to budgets, but are necessary to ensure their protection. McManus points out that proper technique is really important once players get into high school because now they are larger and stronger, and impact could cause more damage. He references the fact that some seniors tower over freshman players, and that size difference makes the game even more dangerous. He highlights the importance of teaching players about CTE, citing that 80% of college players are not aware of the disease. He says that he will continue to play even knowing the risks involved, yet be willing to retire if he feels like he's at risk of developing CTE, like if he experiences repeated concussions or starts to show symptoms. The next article I'm talking about is called Most Football Players Who Donated Their Brains to Science Had Traumatic Injury by Amy Cunningham. In this article, researchers studied the prevalence of chronic traumatic encephalopathy, CTE, in the brain of deceased football players. CTE can only be diagnosed after death and can be seen by the buildup of the protein tau in the brain. And you can see from the image on the right the difference between the tau buildup in a brain that showed mild CTE and severe CTE, and the tau are the red spots. Researchers found that 99% of the brains of NFL players they studied showed development of CTE, but it's important to point out that all the brains were donated by families who noticed symptoms of the disease in the players while they were alive. These symptoms included behavioral and mood problems such as anxiety, impulsivity, and depression. The reported symptoms were relatively similar between players that were found to have mild or severe cases, except for dementia, which was more commonly seen among players with severe CTE. The severity of a player's CTE seems to be correlated to how many years they played. High school players showed mostly mild cases. About 50% of college-age players showed severe cases, and 86% of NFL players showed severe cases. Because CTE cannot currently be diagnosed and treated, it is necessary for teams and coaches to focus on prevention by using proper technique and speaking out when a player does experience a concussion instead of letting them play through it, which used to be the norm before so much attention was drawn to the brain injuries seen during football. The author of the article pointed out that the findings of this research do not show that every player develops CTE, but is something that they should all be educated about because they need to be aware of the risk involved in playing football and be able to recognize the symptoms.
Hello, I'm William, and I'll be talking about traumatic brain injury in the content of military. 320,000 U.S. service members have suffered from TBI, including an example we got from the reading. Jeremy, a combat engineer in Iraq, got TBI while finding roadside bombs. The impact of a blast wave that the soldier receives often leaves him with both TBI and PTSD. So, for example, Jeremy became more irritable with his spouse and child, which is a pretty common behavior for a PTSD patient. Some victims eventually recover from TBI, but the severity of TBI are not diagnosed upon its long-term effects. Rather, it's depending on the immediate effects of the patient. For example, some severe TBI patients may suffer unconsciously for 4 or 5 days, but when they wake up, their brain acts pretty normal and thus they can have a normal life. Whereas Jeremy had a mild TBI, his life was affected significantly. Victims suffered from mild TBI receives random motor, sensory, or cognitive or emotional signals from the brain, which is a syndrome called simple partial seizures. There are two different types of TBI that one can get from combat. The first one is blunt force trauma. This type of TBI is pretty common to our daily life or sport, which is just damage directly to the brain by the brain traveling inside the skull and hitting the skull, causing the tissues to be damaged and the blood vessels to be stretched. The second type of TBI that we can get is from shell shock. That is damage made indirectly to the brain but can damage the brain in similar way that blunt force trauma does. The results of either type of TBI is that the axon material dilate by elongated rapidly, which then is lethal to the neuron. And also, neuronal static can be induced by the altered electric signal caused by the concussion, which then can cause the victim with cognitive malfunctions. For example, we just mentioned the patients might receive different random sensations. So TBI caused by pressure is a good example of a shell shock. Pressure gap created inside the skull before and after receiving the blast wave damages the nerve tissues in a similar way of a direct trauma. So on the lower left corner, we see the blast wave create a high pressure air wall that travels away from the initial explosion, and upon receiving the high pressure air wall on the human body, as we see on the right image, part of the pressure are blocked by the human body, and since soldiers will wear a helmet, the some of the pressure will travel inside the helmet, creating a pushing force to the skull. And since part of the skull were being pushed down, more volume needs to be created, and the skull will bump on the back side, thus creating a pressure difference inside the skull and inside the helmet. And to remind that this is not a static motion, but is a ripple motion, that as the pressure wall moves, different part of the skull can experience this extreme pressure difference on the two very close sides. For example, here we have a part that has a very high pressure of 2.75 bars, and just close to this side we have another area that is experiencing nearly zero pressure. So this type of condition can travel throughout the brain as the high pressure air wall enters and exits. And the threshold of the pressure that can cause TBI is lower than 1 MPa, which is 10 times the atmosphere pressure. But the resulting damage is similar to any other types of TBI. So the TBI caused by pressure can not only directly hit the brain, but can also indirectly hit the body first and then create a ripple effect that damages the brain. So as the body receives blast wave, major ventricles and blood vessels in the body are being pressed, and they will be forced to release more blood at a higher speed to the brain, thus causing the brain to be damaged. Lastly, TBI and PTSD. As I mentioned, many soldiers that got TBI from the combat also have PTSD, and thus they may interact and have a chain reaction on each other, since stress hormones in the brain can slow the process of healing to a TBI patient. And as a Harvard neurologist, Michael P. Alexander states, psychiatric issues are the major obstacle to overcome for TBI patients, since when the patients know they got a disorder that is hard to treat, such as TBI, they become passive on recovery process.
My name is Kira, and I'll be discussing TBI treatment and research for future treatments. So the main problem doctors are facing right now is not necessarily getting the patient to survive, but getting the patient onto a path of good cognitive recovery. And in order to increase the chances of this good cognitive recovery and prevent secondary damage, researchers are aiming to advance methods used in the ER and ICU. Treatments must aim to prevent or stop the flow of broken blood vessels, decrease swelling in the brain, prevent any further release of toxins from ruptured neurons, decrease the brain's demand for oxygen, and improve the patient's quality of life. And as we learned in the military portion of this presentation, TBI is often experienced along with PTSD. So ways to treat trauma is through exposure therapy and anticonvulsant mood stabilizers, which is more often used to treat common epilepsy, but it's also used for patients with PTSD. But regardless of trauma, TBI patients will more often than not struggle with daily tasks that were previously easy to accomplish. So occupational, speech, and physical therapy helps to form new neuronal links in the brain to rebuild damaged connections. And by improving skills and thought patterns, it can help make tasks seem less daunting. There are initial treatments doctors will do before moving into surgery, and one of these is using a diuretic to extract fluid from the blood and elevating the head to redirect blood flow away from the brain. And this would relieve the swelling that comes from elevated pressure and dilated or broken blood vessels. But failure to relieve swelling will cause the brain to push through the hole at the base of the skull, which would crush the brainstem and kill the patient. Cooling techniques like hypothermia therapy is also used to lower a patient's body temperature, and this can be done by injecting chilled saline or using a cooling blanket. By lowering the body temperature, cellular metabolism is going to slow down, which would reduce the brain's demand for oxygen for survival. It can also reduce inflammation of the brain, and an analysis by the Brain Trauma Foundation showed that although hypothermia therapy didn't necessarily affect survival rates, it improved mental capacity and responsiveness among TBI survivors, which I mentioned is important because improving a patient's quality of life after surgery is a crucial part of developing good treatment for TBI. Monitoring brain chemicals is also crucial because TBI causes the release of toxins from ruptured neurons. For example, the neurotransmitter glutamate is released from dying cells, and so if you see an unusually high amount of glutamate, this would indicate rapid cell death. And by monitoring these brain chemical levels through microdialysis, doctors can decide on their next course of action. If there are persistent pressure problems, the last resort would be surgery, which can be done by drilling a small hole in the base of the skull. Doctors can then drain the excess cerebrospinal fluid that is causing high pressure, but in severe cases, doctors will have to remove a large flap of bone from the top of the skull, and this would give the brain space to expand into a larger area. And if you look at patients who have gone through this surgery, they have this huge area of stitching. It looks like a backwards C above their ear, but it's a very large space. And in Duct Tape for the Brain by Lucas Larson, Richard Borgens' research is explained, and he's using he's studying the use of polymers, specifically polyethylene glycol, to repair cell membranes. And in his experiment, Borgens injected rats with polyethylene glycol at various time points after a brain injury, and the rats that were given the injections within 4 hours of the injury navigated mazes well compared to the untreated rats. This indicates that using polymers in rats' brains can help in maintaining good spatial learning and memory. Obviously, a rat's brain has its differences from a human's brain, but Borgens is hoping that this research can eventually develop into an injection that EMTs can immediately use on TBI victims. In How Football Destroys the Brain by Tonica and Wells, a potential blood test to identify brain damage is mentioned. When the brain is damaged, molecules are going to disperse and signal damage, and this causes an immune and inflammatory response, which leads to the release of S100B proteins. And these proteins would leak across the blood-brain barriers and block off contaminants from reaching the brain. And if an S100B blood test is developed, it could offer quick insight into a patient's brain health after injury. Additionally, the NFL Alumni Association is working with NeuralStem to create a product that will target deterioration in the hippocampus. And they're hoping to introduce neural stem cells into the hippocampus to stimulate neuron growth, which will restore memory and halt deterioration. And this deterioration can be seen in symptoms such as tau, which is a protein that stabilizes microtubules, aggregating into tangles, and also the breakdown of amyloid precursor protein, which will lead to the buildup of amyloid plaques. And these symptoms are also seen in patients with Alzheimer's disease, which is a neurodegenerative disease, and its hallmark is memory loss. So the hippocampus is very crucial for memory, which is why repairing the hippocampus can be so important in preventing memory loss symptoms in TBI patients. And that is it for our presentation. These are our sources. I hope you got some good insight on traumatic brain injury and found this topic interesting. Thank you.